Calero Apache peoples. We recognize indigenous peoples as the original stewards of this land. We owe the existence and vitality of our community to generations of Black indigenous people and of people of color around the world who gave their hopes, dreams, and energy to the history which led to this moment. Some were brought here against their will, some left their homes in search of better life, and some have lived on this land for countless generations. Texas Tech University is a land grant institution founded in 1923. When federal and state governments forbid many of us from attending this university, the foundation of our institution came at direct cost to Black and Indigenous peoples, whose land and labor this university was built upon. The Student Intersectional Leadership Council acknowledges these truths as crucial for building mutual respect and connection across all barriers of heritage and difference. Please consider the many legacies of violence, displacement, migration, and settlement that brought us together here today, and join us in uncovering these truths always and everywhere. These are the numbers of the National Suicide Prevention Lifeline, Texas Tech Crisis Helpline, and the Student Counseling Center, second floor of the Student Wellness Center. Meet the panelists, Stephanie Villanueva. Villanueva graduated from the University of Texas at Austin in May 2019 with a Bachelor of Science degree in Public Health and is now pursuing a Master's in Public Health at the University of Texas Health Science Center at Houston. Native to Houston, Villanueva grew up in the historically Latinx community of Magnolia Park. As an undergraduate, she was part of the movement Mujeres, a fellowship by Jolt, Texas, and Dates Not Words. She has experience working at all levels of government. She was a programs intern at Austin Parks Foundation, where she was able to coordinate community outreach to the Latinx population in Austin. A legislative intern for Texas Representative Victoria Naive, and most recently a staff assistant for her local United States Congresswoman Sylvia Garcia in Washington, D.C. Her experience as a student worker and advocate for the advancement of Latinx makes her a perfect candidate to discuss the public health issues affecting our community. Meet our moderators. Dalia Guerrero Villalobos, a senior global studies and general studies major. After graduation, she plans to pursue a JD and become an immigration law attorney and advocate. Dalia is passionate about serving her community through community service and creating events that inform the community. Abraham Garcia, a senior majoring in political science and communication studies. After graduation, he plans to pursue a JD and MBA joint program. Abraham is passionate about helping people in our community succeed and advance in his life. His future plans include running for public office. The Q&A for audience is a QR code, and you guys could scan it or also use the Q&A option through Zoom. And now the Q&A session will start.
Okay, so I'm going to be starting off the questions. These first set of questions are about public health. The COVID-19 pandemic has emphasized the importance of many medical professions, one of them being in the area of public health. Can you tell us a little bit of what public health degree consists of and why you decided to pursue it?
Great, so that question's for me, right? Okay, good. Yeah, so a little bit about why I decided to pursue public health. So I did my undergrad at UT Austin. Like I think many high school students, I didn't really know what I wanted to study. I remember going to the UT Austin website and going through the majors one by one, just trying to figure out what I wanted to do because I didn't want to do like basic science or like what else, like history or math. It wasn't really grasping my attention, right? But then I stumbled upon public health. And I knew right away, okay, that sounds like something I wanted to do. And the reason why I chose it is because in high school, I was really involved with community service. I was in Key Club, I was president of Key Club. And so I just did a lot of community service and I wanted to help people. I wanted to help the community. And then I was really into health in general. So it combined really well, public health, helping the community on the health side of things. So that's kind of how I ended up majoring in that. And then once I was at UT Austin, my major was difficult because it was very science focused, which I feel like it's so important to also do more of a social. So they did have a balance of it, but I did feel like it was very science focused. So it was hard, but I got through it. I knew I wasn't the right major, even though it was hard. But I went through it. And so now I'm doing my master's in public health, and I've really enjoyed it. It's my very first semester. I've enjoyed it way more than undergrad. Why? Because it's way more specific on the social side of things, and we'll go more into that in a little bit. But yeah, that's kind of how I ended up with public health. That's my career, and I've really enjoyed it so far. I've learned a lot.
Thank you, Stephanie. The next question is, in 2014, the U.S. Bureau of Labor Statistics reported that Latinos consisted of 7.7% of all healthcare practitioners and technical support. Why is it important for more Latinos to be part of the medical field? As your experience as a student who has done her bachelor's and is now pursuing a master's, do you see more Latinos wanting to pursue public health, or is it still pretty low?
Oh, there it is. I personally feel like public health is, people are more interested in it, but I feel like people are still learning about it. People really don't know what it is. Even my family, I kind of have to explain to them like what the difference is between like public health and medicine. So the easiest way for me to explain it, right, is public health focuses on the community as like large neighborhoods, and medicine, the medical field is like an individual level. So you help a person like at a hospital or at a clinic. So the reason why public health, we need more, I do feel like we need more public health professionals, because so much of the disparities that we do see in the Latino community are happening because of the policies that we are implementing and the laws that are in place. And so I'm thinking about like the students in my classes, right? As Latinos, we still are underrepresented in the college level. So right now in undergrad, like if I go through the list of my classes and see the people that are taking these classes, not a lot of them are Latinos. There's a couple, and it's growing, I would say, but it's still predominantly white people or Asians. There's a small amount of Latinos and Blacks. So I definitely feel like we need to learn more about the public health profession and consider looking into pursuing a public health degree.
Awesome. As we noted prior, you have experience at all levels of government. What did you take from those experiences, and how would you apply them to your public health career? How do you recommend a student watching this to get involved?
Yeah, so a lot of what I'm speaking about is my personal experience. Obviously, it's different for everyone. But I guess I'll get started with some of the internships that I've done. When I was an undergrad, I knew I wanted to get an internship. I mean, everyone wants to have some sort of experience, some internship, right? And so it took me a couple years to really get into it, but once I did, opportunities started coming. So the very first internship that I did was with Austin Parks Foundation, which is a nonprofit organization in Austin that raises money for the parks and collaborates with the city, actually. So Austin Parks Foundation is not a government, but they work with the local government. And so why is it that I looked at this internship specifically? Is because parks are so important in the health of people in the Latino community. And so I actually was looking into this, and one of the things is that there's more parkland in a lot of places that are predominantly white compared to communities are Latino or Black. And so it's a known fact that to be healthy, we should have parks around us, places where we can go walk, where we can go run, where we can feel like we can go work out in. So if we don't have parkland, people are not going to be encouraged to go out and exercise. And so that's one of the things, right? It's very like specific, but that's why public health and looking at parks is interconnected. So that's one of the internships that I did. And once I did that, I wasn't getting paid a lot. It was one of those things that I felt like I had some sort of privilege where I could choose this internship and I could pursue it. They were paying me minimum wage, $7.25 an hour. But I knew it was a great opportunity, so I went for it. I know many times as Latinos, like, we might not be able to do this because we need to work and we need to pay for our classes. So I did have that privilege, so I did it, and I just went for it, and they got me. And as a Spanish speaker, they want to see more Latinos. They want Spanish speakers. They want people of color that can relate to the community. And then after that, I interned at the Texas House, right? So once I had that very first internship, I feel like I got so much experience there that I felt encouraged to go and intern more on the government side. Another thing there is that a lot of the internships at Texas State Capitol are not paid. And so this one also wasn't paid with State Representative Victoria Niave. I knew I wanted to intern for her because she was Latina, she was a Latina woman, and I think representation is so important. And so I did it, and it was a great experience. I would encourage anyone to look into interning at the Texas State Capitol. And then once I did that, I applied for the fellowship in DC, in Washington, DC, with Congresswoman Sylvia Garcia of Houston. And I got it there. So I was able to be in DC for a little bit. That's how I met Dalia. And I met so many other great people. It was a great experience. I felt like I could have done more with the policy. I didn't do a lot on the policy side. It was more constituent work. But constituent work is so important too, because, for example, in Congresswoman Garcia's office, her district, she represents a predominantly Latino community. You know, where I grew up, it's predominantly Latino. So even though I wasn't doing more of the health policy side, I still felt that it was very meaningful to be able to speak to constituents in Spanish if they needed it, and in English as well.
Right. Thank you so much, Stephanie. I also want to remind everybody that we'll be doing a Q&A at the end of this main Q&A session. So please, if you have any questions, use the Q&A portion of Zoom, or you could use the link that was sent through the messenger and use the code below. All right, so for the last question for this section of the conversation, if you were to give a pitch to Latino students on why they should pursue a career in public health, what would it be?
I've actually been thinking a lot about this because I think two of y'all, like part of the Texas Tech group that's leading this panel, I think mentioned that y'all want to pursue to be a lawyer. I think Dalia and Abraham. I think that's a very popular like job that Latinos and like people of color want to pursue, because it's like, okay, we grew up with the idea, okay, I want to be an engineer, I want to be a doctor, I want to be a lawyer, which is great, right? It's great. But at the same time, we need to look more at the root of the problem. So public health focuses on policy and changing policy, right? So to me, policy leads to laws. Not to me, but that's really how it happens. Like, we need to advocate for the policy changes to happen. And then once we do all that, legislation passes, then it becomes a law. So looking at the root of the problem is so important. So I'd encourage you to think about that. And then like an example I wanted to give you actually is, I just learned this in one of my classes. I guess I kind of had the idea, but it was just confirmed. Basically, one of the things is that a lot of the issues that we have here in the state of Texas and in the United States as a whole is that we have lower life expectancies compared to other countries, okay, and lower health. Our health is not very well. But why does that happen? Many times we think, okay, we need universal health care, we need Medicare for all. Yes, we do, and that's a policy change. But another thing is that we as a country, the United States, we are not egalitarian. We need to be more egalitarian. What does that mean? That the social policies need to be implemented and they need to become laws. And some of these social policies are, for example, very simple, like living wage jobs, paid sick and family leave, paid vacations and universal preschool. In other countries, these are laws, these are mandated. In the United States, we don't, and we don't have them. And so that's why our healthcare and the Latino community are suffering. So that's why I'd encourage people to like look more there at the root of the problem. And so, yeah, I'm very passionate about policy. So hopefully you guys can look into more into it. And if you have any questions, let me know.
Awesome. The next few questions will be about COVID-19. Latinxes are one of the groups that are most affected by COVID-19. Can you tell us, from what you have learned through your education work and advocacy, why is this the case? What are the factors that contribute to this disparity?
Yeah, so it's a lot of factors. I don't have all the answers, don't have all the numbers and facts, but this is the reality. The reality is that COVID really just showed us the issues that we had. We've had these issues like inequalities, inequities in healthcare, right? But COVID has just shown it. It has proved it. Why? Because the numbers of people, Latinos, that have been affected by it are greater than white people. So just Black, we know Black, Indigenous, and Latinx people are more impacted. The numbers show it. But we didn't know this until recently because of COVID. Or I guess we did a little bit, but COVID just really proved it. I have an example here written down that I'd like to share with y'all that shows a little bit as to how all these disparities already existed and they're built this way. So for example, on average, how many more supermarkets are there in predominantly white neighborhoods compared to predominantly Black and Latinx neighborhoods? So that's the question. The answer is there are 4 times as many supermarkets in white neighborhoods as compared to Black and Latinx neighborhoods. Okay, and a lot of the times this is known as food desert. I personally like using the word food apartheid, and food apartheid is still not very common, but the reason why we should switch from food desert to food apartheid is because by using the term desert, it makes it sound like these communities are like empty, right? But they're not. These are communities that are lively, that have so much life going on. These are our families, these are communities. And so food apartheid, what does it stand for? What does it mean? It's structural oppression based on race and class that limits access to power and resources related to food and land and results in poor health and poor people. So when we don't have access to all these things, our communities are going to be negatively affected. And so we need to think about that. And so because all these things have been happening for so long, our communities are just not healthy. They have diabetes, they have health issues, heart issues. And so that's why COVID has really just been impacting us, because our policies, our legislation, our laws that we have in place are not helping us. So we need to change them.
Thank you, Stephanie. Our next question is, can you talk about the mistrust that Latinx people have towards the government? What recent events would you say that has contributed to the mistrust? Do you believe it has an effect on pandemic relief measures for our community?
Yeah, this is a little harder for me to answer. And the reason why is because on the personal side, I've made it my goal with my family to go out and vote. And I made it a goal for them to understand the root of the problem. Okay, why is it that this is happening? Why is it that? So it's really done with through conversations, especially with our families. We have the power as people that are in college, that are pursuing higher education. Many of our parents might have not graduated college, or maybe not even high school. And so having these conversations with them and explaining to them in the simplest terms how government is connected to our daily lives. I personally had this conversation with my mom yesterday where I was telling her, don't say that it's politics. Oh, it's just politics. to me, things are not just politics. In reality, these are issues that are going to affect our community. So I don't see it as politics. It's not a game to me. This is serious. So voting for people, organizing, going out and like doing something about what's going on, it's so important. And so having these one-on-one conversations to me helps build that trust between our communities and the governments. I know the government is not the solution to it all, right? But it is one of the solutions that we could look into. And so to me, that's just probably the most important to gain trust between government and our community. And representation. We need to be in these positions, right? We need to be a part of these government positions, making these decisions so that our family and everyone can trust us. For example, AOC and the squad and all that.
Okay, this is going to be the last question for the COVID-19 section. What are a couple of ways that a person with a career in public health can help alleviate these disparities? In your personal opinion, what are some solutions in government and or the healthcare system you would like to see?
Yeah, and I kind of mentioned a lot of this already, I would say. One of the big things for me is Medicare for all. I'm a strong supporter of it, and I encourage people to advocate for it and not be ashamed of it, because it's not a bad thing. It's a good thing. And yeah, universal healthcare is so important. Many other countries have it. They're doing so much better. We're not doing that well. So that's one step. Another thing, though, like I said earlier, is like more broad policies, like I mentioned, living wage jobs. I think higher pay. I just saw an article on CNN saying how Switzerland raised their minimum wage to like $25 an hour or something like that. In this country, it's $7.25, and it's been $7.25 for more than 10 years. We haven't changed it, the federal minimum wage. So that's one thing. Representation, like I said, we need more people that look like us making these decisions. We're the ones being impacted, so we need to be on like everywhere as much as we can. And that's why I also encourage you guys like Dalia and Abraham that want to be lawyers to also do that. That's part of representation. We also need more brown lawyers. But health is just connected to everything, right? Everything. We just mentioned parks, grocery stores, policy. It's just all connected. So it's just, yeah, I don't know what else to say. It's just changing policies and laws. They're gonna help us.
All right, thank you, Stephanie. So now we're gonna move on to something I feel like every student currently now is experiencing is our mental health. And so one of the least talked about subject for Latinos is mental health. According to the American Psychiatric Association's 2017 report on Latinos and mental health, it reported the following. Latinx and Hispanic adolescents use antidepressants at half the rate that their white counterparts. Children use stimulants for ADD and ADHD at half the rate as white children. And mental health problems can be hard to identify because Latinx Hispanic people will often focus on physical symptoms and not psychiatric symptoms during their doctor visits. In your opinion, why is this an underrated issue, and what are some ways to help alleviate this?
Yeah, I can definitely answer that. And feel free to ask me any questions that any of you guys have. Thank you for being here. A lot of what I'm sharing is also personal, so this is going to be more of a personal answer as well. When I was an undergrad, I didn't reach out for mental health help until my senior year. And I feel like I should have done it earlier, because throughout my time at UT, I was doing very bad academically. I was not passing my exams. I was not doing well. And that added to the 2016 election, made it worse. And so once 2016 happened, I definitely felt like my mental health went even more down, or yeah, it took a really bad turn. So I did seek out help, but I waited too long. So I'd encourage all of you to seek out mental health resources earlier on. I guess I didn't really know that that was an option, and I felt like I was okay. But in reality, everyone has mental health. We should take it seriously. It's the same as having physical health. We go and do our physical exams every year or so, and so we should take mental health seriously as well. And I did see at the beginning of y'all's presentation that you get 6 free sessions at Austin, at Texas Tech. At UT Austin, we also had some free sessions, so I did that. And then they referred me out to someone in Austin, and she was Latina. She spoke Spanish. She even got to meet my mom once and spoke Spanish with her. I just did it, and I encourage all of you guys to just do it. Give it a try. Don't be afraid. Don't be ashamed. I was going through a lot, just anxiety and depression. And what really pushed me to seek out help, though, was I was taking a nap after one of my classes. It was maybe 8 p.m. I woke up from my nap, and my heart was just racing. And I was like, okay, this is not normal. And I had already been thinking about seeking out mental health. But then when that moment happened, when my heart was racing like that, I'm like, this is not normal. I'm going to go seek out help. And I did. And so now I'm making it more of a routine. Mental health is difficult to access, though. It can be expensive, and there's just not enough Latino, Latinx, or Spanish speaking therapists either. But you can find one. But it's difficult and it can be expensive. But I try to make it a routine where I see a therapist once or every 2 weeks. And it definitely helps to just talk to someone about whatever's going on in your life. Nothing serious needs to be going on. You just got to talk to someone.
I think you already answered part of this question, but Latinx students and students of color in general are faced with many mental health issues, whether it's depression, anxiety, or other factors. How do you suggest a student take the first step for counseling? How did you decide it was time for you to seek counseling when you needed it?
Yeah, I've definitely answered, I think, most of it. But Dalia and I actually spoke a little bit more in depth about this, and I'd like to share this with you. But she kind of suggested, okay, how do we get this conversation going with our families, right? Because it's very stigmatized in the Latinx community. And I was just telling her, you know what? You just got to do it. Who cares what your parents think? You just gotta do it. And once you feel like it's a good thing for you, they're gonna have to accept you because they love you, they care for you, they want you to be okay. And so you're already an adult. We're adults here. We can take ownership of our decisions. So if we feel like it's the best thing for us, then go for it. Yeah, and even if you don't have your family support, it's okay. You do you. So that's a little bit of what I like to share there.
And I think I like to add into that because we did have a conversation before this panel, and we did talk about mental health, because we do want to push the fact that yes, we have all these issues of diabetes, depression, everything, but we got to look back to what it originates from. And yes, there are outside issues, like you said, we don't have that many supermarkets in our area where we live, and that affects our health. But also we got to look at our families. And sometimes as Latinos, as Latinas, as Latinx people, we have multi-generational trauma, quote unquote. And so the solution to that is to break the generational where it stems from. And so it starts with us. It starts with us seeking mental health. And I can say this personally because I know the pandemic really did affect me, and I finally decided to choose to seek out counseling. And it honestly, my life has been a 180, because you look things in a different lens. And if you're not ready, you're not ready. But once you feel like it's time for you to seek out counseling, then it's going to be many steps forward towards that. So your life is just going to not be a little bit easier, but things are going to be a little bit clearer for you. So that's my perspective of it, and I'm glad that you brought up our conversation, because we definitely want to make sure that for the students viewing this, that we do have those resources that Texas Tech provides, and that even though you're not ready right now, know that there's an option, and know that there's resources, and know that you could be the one to change that generational trauma for if you decide to have kids or anything like that. I mean, it's something that all Latinos, everybody of all races, need to see and reflect on, because it affects everything. So thank you, Stephanie, for mentioning that. And I also like to move on to the last question that we have with us, but we also have a couple questions that people have submitted, and it's not too late to submit more questions. Please, if you have any more questions, submit it through the link or through Zoom. But this next question is, as a current student, life can be pretty stressful, especially during a pandemic. What are some ways to keep yourself healthy, and what self-help tips would you give to students?
Yes, I love this question. I would encourage meditation, and that's very accessible. There's apps on your phone that you can download. I really love Insight Timer. Insight Timer is great because it's free. All of the meditations are free. You don't need a subscription, and they're really good. I use it personally to sleep at night. I do sleep meditations, and it helps me sleep so well. I used to listen to podcasts before going to sleep, so that doesn't help, because I'm a huge political junkie and like news junkie, so I like knowing what's going on, current events. But I realized, okay, that's not helping me at night. I don't need more of that at night. So I switched to doing sleep meditations, and it helps me sleep like a baby, and I fall asleep super quick, and I don't wake up in the middle of the night. So that's really great there, Insight Timer. Another thing is yoga. I do encourage yoga. It's a good way to get moving, a good way to get your workout in, and you can find free videos on YouTube. You don't need to have a subscription. I don't like paying for anything, so I find all the free stuff. Those are two things: meditation and yoga. What else would I suggest? Sleep. I think as college students, many times like we don't prioritize sleep, but we need to try, and part of that is just trying to not procrastinate, like try our best to really like get going throughout the day. And instead of drinking coffee, I'd suggest tea. So I made the switch from just coffee to green tea, caffeinated green tea. So it still has caffeine and it helps me focus, but it has less of it. And another thing is organization, right? So I use Google Calendar. I think many students do use Google Calendar, but I really love it. It helps me stay organized and less stress knowing how my day is going to look. What else? Yeah, that's what I can think of right now. So I hope those tips helped a little bit.
All right. Thank you so much, Stephanie, with those tips. And I really encourage everybody to have more sleep because it definitely makes a difference on your day. But we're going to move on to the questions that people have asked through the link. And the first one is, what advice would you give someone who is pursuing an MD or MPH who is also Latina?
That's awesome. Okay, so what advice would I give y'all or someone pursuing MD, MPH? I would say that's really cool that you're doing that because it's like 2 different degrees, and I feel like more doctors need a degree in the master's in public health because MD is like very science focused, and we really do need to focus more on the social side of things. I would say just say yes to as many opportunities that show up. If you get invites to something, if you get links to a fellowship or a link to an internship, just do it, give it a try. And be patient. That's another thing. And I've had this conversation so many times with my cousin, because I feel like many times we feel like, okay, we need to be over here already. Like my parents personally, they wish I was working already. They wish I was making money, but I'm like, no, I'm taking steps. Okay, I got my bachelor's. Many people go into the work field, like workforce right after undergrad, but no, you don't have to do that. Go get your master's or go get your MD or go get your JD. Even though it's gonna take a couple years, don't be afraid and don't be scared about that. Like, just be patient. It's gonna work out eventually. It's gonna be worth it at the end. I know it's gonna take a couple years and time, but we need you in the field. So congrats and good luck.
Okay, so the next question, another disparity between Latino and Black communities versus white communities is the fact that healthy food is not readily available as junk food. What is the solution?
Wait, can you repeat the question again?
Another disparity between Latino and Black communities versus white communities is the fact that healthy food is not readily available as junk food. What is the solution?
Okay, I gotcha. I get you. Okay, so like what could be a solution? Okay, so I actually have something written down about that. So predominantly Black and Latinx neighborhoods have more fast food franchises and liquor stores, and often lack grocery stores that offer fresh, affordable fruits and vegetables, which is what y'all mentioned. So yeah, it's a reality. I'm thinking about Austin. There's an area called Riverside. That area is just south of just south of campus, and it's predominantly Latino, predominantly BIPOC, and that's where I lived. That's where my apartments, and I did see a lot of fast food restaurants, and I did see a lot of liquor stores, and there was an HEB, which was great, but it was just like that one HEB that everyone really went to. Compared to like other neighborhoods across town, I remember I like eating healthy, and I tried to stop eating the Taco Cabana that was nearby or the Wendy's, and I was looking for something healthier, and I said, okay, I want some Panera bread because they have salads. But when I Google mapped it, it was like on the other side of the freeway. I had to drive out like 15 minutes, 20 minutes to go get Panera bread. And I'm like, why can't we have a Panera bread nearby? Why can't I have a place where I can go get a healthy salad nearby? So it's a reality. Solution to it, I would say having these conversations. Many times I hear people say, okay, we don't have a voice. Yes, we do have a voice. Everyone has a voice. We should use our voices. We should speak up. We should attend meetings. We should try. I know sometimes they can be hard because we don't have the time, or we are just so busy with like school or anything else, but a little bit at a time, it helps. Look into your local governments. Look into, like city council nearby in Lubbock, near Texas Tech, and speak up, speak out. Tell them what you think and the disparities that you see, and hopefully they'll do something about it. We do have power. There's so much power when we get people together. Hashtag power the people. So yes, I would say, again, like policy is just so important. Laws to change this, speaking up and changing it. A lot of the changes won't happen unless we say something about it. We need to bring it into light. And we have the power to do that. Personally, I can think about how our voices matter so much when I tell people, for example, I don't like using the word minority, and many people still don't know that. So I try to speak about it and explain why we should move away from the word minority. So that's like an example, right? Use the opportunities that you have to talk to people and tell them. So why, for example, why shouldn't we use the word minority? It has the word minor in it. So it's making us sound like we are less than when we are not, especially in Texas. In Texas, right now, and Jolt put out a report about this, right? Half of the children in Texas are Latino. So we're not a minority, and soon we'll be like the majority in the state of Texas. So we shouldn't be seeing ourselves as minorities when we're not. And so that's kind of like how we can change these things, just having these conversations, talking to people, and bringing it into light.
Thank you, Stephanie. And I also like to add into a little bit more about the disparities and what is a solution that we have locally. And so I'm part of a Facebook organization that is from across Lubbock called Lubbock Compact, which is basically aiming for more construction, more renovation within Central Lubbock, East Lubbock, and North Lubbock, which are the most Black, Hispanic parts in Lubbock. So as the students here watching this, go ahead and reflect on going across town and realizing that most of the things, the new HEB that we're gonna have in town is gonna be in South Lubbock, which is predominantly white. The most of our franchises, or like you said, McDonald's, all those good stuff, is gonna be seen mostly in East Lubbock, North Lubbock, and Central Lubbock. And so what Lubbock Compact is basically an organization telling the city council, like, hey, these are the disparities that we're having. And many Texas Tech students from the economic department, and all different departments have helped in researching this, is that there are disparities that are seen through health with the pollution that we have in East Lubbock and Central Lubbock. And there needs to be a solution to this. So their solution is to have more investment into East Lubbock and North Lubbock, and have more of that power dynamic change a little bit. Because if you're a student here in Lubbock, you do see that there are disparities that, I mean, if you're from a bigger city, you kind of stay within an area, but here you get to go all across town within 15 minutes. So you get to see a little bit more about everything. But I did definitely want to add that, because I think we also got to realize that even though we're not from Lubbock, we still live here, and we still kind of change the environment here. So get to know Lubbock a little bit more. Lubbock Compact, if you want to research it, just look it up on Google. They are doing amazing things. And if you want to join their Facebook group as well, they have amazing community service opportunities if you want to volunteer on your free time. But the next question is, how do you think we could increase awareness in underlying health conditions within the community?
Yeah, so that question is kind of connected to what Dalia just mentioned. And I wanted to say that you guys, all of you, are already taking the first step. You're watching this panel, you're here, we're having these conversations. That's the first step. So, you know, applaud yourselves for that, right? And so, like, the next step is taking these conversations out. We need to not only keep them between ourselves, between the Latino community and the group that's here, but having them with everyone else, especially people that don't look like us, people that don't have the same backgrounds as us, people that don't really understand it. I know it can be hard sometimes, because it can definitely affect our mental health. You don't have to do it all the time, but, you know, small steps helps. And like Dalia just said, getting involved in your local community is so important. You might not be from Lubbock, but you will be in Lubbock for a couple years, because that's where you're doing your degree. That's similar to what I did. I am from Houston, originally from Houston, and I went to UT, and I was there for 4 years or so, 5 years actually, because I stayed after. And I got really involved with the Austin community. So I actually was not involved with Houston at all. It was all Austin. So, like, I know my city council people from Austin. I was involved with, like, the county and all that, and it's gonna happen. So it's a good thing. It's not a bad thing. But now that I'm back in Houston, now I feel far behind over here, because there's so much happening in Houston. I don't know anything, because I feel like I have all my connections in Austin and I don't have them in Houston. So I'm like starting all over again. But yeah, take advantage of that. Be involved in the community that you're in the moment. You know, we have so many years ahead of us to do as much as we want to do. So yeah, that's my input there. Was there anything else specifically to that question that I didn't answer? I'm not sure.
I think you answered it, just of how we could increase awareness of the underlying health conditions in our community. I think it's mostly about reaching out and
conversations, not being afraid, and having these conversations just like we are doing it, but having them outside of our own, having them outside of our own communities.
Okay, so the next question is, do you think that there is a barrier between the trust of the Latinx community and the people who give us the information we need? Example, like the CDC.
Yeah. Right now it's complicated, right? Because of the incumbent of the White House. I feel like I used to be very, I could trust the CDC. I used to, but right now it's kind of iffy, and I don't really. That's just the reality of our government right now. You can't really trust anything. But let's not allow someone like that person to ever be in power ever again. So we are not in this position ever again. That's one thing. And yeah, I mean, I feel like a lot of the Latino community, it's not that they are not aware of what's going on, for example, in the government. They just really don't have the time. They are busy working, and they are older already, and I don't know, they're focusing on their families. So I guess there's so much power here in the youth, in us, to change that. So it's okay for, I think, for the older Latinx community to maybe not, for them to not trust the government. Like many of the older people maybe don't trust the government. I would say it's kind of hard to change that. We wish we could change people, but they've had this train of thought, their way of thinking for so long already, that it's just going to be difficult. So I wouldn't spend my time and energy there. I would do it with the younger group, the new generation and our generations. I mean, it is possible, but it's just harder, and I wouldn't waste my time. I would just focus on how to prevent that and how to change it for us not to have to distrust the government. So kind of like looking again at the root of the problem.
All right, thank you, Stephanie. I think this is a very interesting question because it involves cooking and things of that nature. How would you start breaking the unhealthy traditional cooking for younger Latino Black generations?
Wait, how to break what again?
How to start breaking the unhealthy traditional cooking?
Oh my God, that's so hard. Yeah, no, I don't think we need to. I think it's more about like balance. I think we should embrace our culture, and we should embrace our food. That's what makes us us, you know. I'm thinking about tamales right now and gorditas, and like the reality is that it's just gonna be hard to change it. So, for example, with my grandma, she lives with us, and she really likes tortillas. And obviously, tortillas are not that bad, but if you eat a lot of them, anything in large proportions is bad. So I tell her, okay, only two. And I watch for her to only eat two, and that's it. Like I give her a limit. And also the sugar, she really likes putting a lot of sugar in her coffee, so we kind of hide it from her. So yeah, it's just like small things like that. Don't buy it. Just don't buy Coke. Just don't buy like the unhealthy things, chips or whatever. You can have them a little bit at a time, once in a while. But yeah, I wouldn't give it up for sure. It's just more of like a balance. Yeah, it's kind of hard. I don't know, maybe just like increasing knowledge on how certain things can be bad, and hoping that people understand how like eating a lot of it is not great. So yeah, just focusing on awareness, I would say, is important. Making it culturally appropriate whenever we do awareness, or we do outreach. Focus on those points that our diets are not the healthiest, but what can we do to make them a little bit healthier? And that's all part of public health promotion. We can decide how we're going to talk about it. and how we're going to focus on it for our families and our culture to really get it a little bit.
Okay, this is the last question. So if anyone still wants to submit a question, you can. But I think this is also, you kind of answered this already as well earlier, but why is mental health such a difficult conversation for Latino families? And how do you think younger Latinos can start a conversation with their parents?
Yeah, and Dalia mentioned how we have to break the cycle. We're going to be the ones to break the cycle. The internet, there is so much intergenerational trauma, but the thing is that we don't even know what it is. We don't even know the trauma that we have. We really don't, but a lot of our life and the way we grew up is part of our trauma, can be part of our trauma. We don't see it as that because it's just so normal, so ingrained in us. And so the first step really is acknowledging how important mental health is, and doing it for ourselves, but also doing it for like our future families. Because if right now our parents don't really like it, they're like, what are you doing? Like, what do you mean mental health? So now that we get it, our children we're going to be able to support our children. We're going to be like, yeah, you can do it. You can seek out a therapist or a counselor. You can get on medicine if that's going to help you. And our generation's going to understand the importance of it. So we're not going to make our kids feel bad. So it's on us to like make that first step. And having these conversations with our parents are important. If you feel like you can have them, it's good to have them. If you feel like it's not worth it, it's okay. Whenever you feel like they're ready, maybe do it a little bit at a time until they kind of start getting it. It took some time with my family, but I felt like they were able to get it. And now it's more normal. Yeah. I think there's so much power in just talking to them if you can. Yeah, and giving them examples of like other people that have gone through it, or like the effects that could have, or like the importance of it. Yeah.
I'd like to say one last thing before we end our session and before Brandon takes it off so we can end the conversation, is that thank you so much, Stephanie, for being a part of this panel and being able to discuss about these issues, because I don't feel like a lot of people, especially people who do want to go into medicine, realize that public health is the structure, the foundation for a lot of things. And especially, with this conversation made me realize that, yes, I want to be an attorney, but I should really look deeper into what that actually means. And so I really hope the people who are watching this and the students watching this today can kind of realize that their professions, even though they do have a label to it, they're more meaningful than that. And so it goes back to how you treat people within your community, what resources you give, who you mentor, because it goes a long way for our community. And also I'd like to announce that today is the last day to register to vote here in Texas. You can go to vote.org to check your status, see if you registered. If not, you get registered. And also like to thank all the organizations here on campus. I know Jolt, UMI, and HSS, they all got together and they all registered people to vote. And so the things that they've done for our community and for getting people to register to vote is very, very important. And like we said during this conversation, getting out to vote, it's more than just political. It's not a game, like Stephanie said. It's people's real lives are at stake here. And so I like to thank Stephanie for the opportunity that you gave us to give us so much information about your work and what you plan to do. And so that's all I have to say. And remember, get registered to vote and make sure you vote. And there's early voting too, so you don't have to wait in line. But now I'll pass it on to Brandon to finish us off.
Okay, thank you so much to Stephanie Villanueva, to Dalia and Abraham for this. So Thank you guys so much for attending the Health and Latinx Community Panel. And please be sure to tune in next week. We will have the immigration issues affecting the Latinx community. This will also be on Monday at the same time. Please make sure to check out all of our social medias. That way you can stay updated. Thank you so much for attending.
Thank you.
And we'll stay on the call until we go out of live. By the way, I think that was the most questions we've gotten compared to this last panel. So I feel like a lot of people were getting a hang of the conversation. So that's really good.
Awesome. Good job, guys. This is a great panel. I loved it. I've never really seen